due to a technical issue that was identified in routine quality assurance checks, about 6,000 lab tests were not included in yesterday's update. This was a one-time error that only affected our public reporting, not the notification of any positive cases. This issue has now been fixed, and we are including them in today's update. As a result, we are reporting 582 new cases in the province. This includes 421 cases, which were identified over the last 24 hours. The change to yesterday's numbers will be reflected on our website, and the overall positivity rate did not change yesterday. Yesterday, we completed more than 11,500 tests, and our positivity rate is currently about 3.6%. Looking to schools, there are currently active alerts or outbreaks in 304 schools, or about 13% of schools in the province. Currently, these schools have a combined total of 763 cases. We continue to see a decline in our hospitalizations, which benefits every Albertan. There are currently 517 people in hospital, including 93 in the ICU. Sadly, 13 new deaths were reported to Alberta Health over the last 24 hours. My condolences go to the family and friends of these Albertans. We have now detected 68 variant cases in the province. Unfortunately, out of the 11 new confirmed variant cases yesterday, all of which are B117, or the strain first identified in the UK, 7 of these currently have no known link to travel. Investigation is underway with detailed follow-up of all these cases and their contacts. 2 of the new cases, which are travel-related, have been identified as having potentially exposed 2 additional schools in the Calgary zone. As I mentioned in previous updates, these individuals did nothing wrong, and unfortunately, the exposure was the result of a overlap in incubation and quarantine periods. In the schools that we identified exposures in earlier this week, I am happy to report that there has still been no spread detected within any of these classes despite enhanced testing. However, with these 2 new schools, as before, it is important to know that anyone who may have been exposed was already quarantined after the initial COVID positive test. We are now offering all close contacts the chance to get tested twice as a precautionary measure. We are actively reviewing the literature and experience around the globe to assess if additional measures are needed in schools and other settings in the weeks ahead. Evidence is still emerging, but we are watching closely. If we need to make changes, we will do so. So far, we have administered more than 112,000 doses of vaccine in the province. More than 21,700 Albertans have now been fully immunized with 2 doses. We continue to monitor every dose administered for any adverse events. And so far, we have not seen a significant increase in the rate or severity of reactions. For more than 112,000 doses, there have been 53 adverse events reported. This rate is on par with this year's pneumococcal vaccination program. 11 of these events were an allergic reaction, and these individuals will see an allergist before getting their second dose. The most common other reactions have been symptoms such as swollen lymph nodes, diarrhea, vomiting, or a rash. We are posting daily updates online, and I will continue to share them with you because I know it's important for Albertans to understand that we are closely monitoring the immunization program and that no safety signals have been reported with either vaccine. Current evidence from around the world indicates that these vaccines are safe, and the benefit of being protected from COVID-19 outweighs the very rare risk of a minor adverse event. As you know, several new strains of the SARS-CoV-2 virus, or the variants that we are talking about, have been identified in Alberta and around the world. These variants are similar to, but more infectious than the strain we've experienced so far. Evidence is still emerging on the effectiveness of the vaccines on these variants. It's important to remember that the Pfizer and Moderna vaccines are only a few months old, just like the variants. There is much we do not yet know, though researchers around the world are investigating. early investigations so far appear to suggest the current vaccines may be somewhat less effective against some of the new variants in terms of preventing all symptoms of COVID-19. However, even against the variants, these vaccines still appear to be extremely effective at preventing severe cases, hospitalizations, and deaths. Again, research is still emerging, and there are a large number of vaccines being developed as we speak, so we will continue to watch the emerging literature closely. As I've said before, there is no one right way through this pandemic, and there are a diversity of perspectives about how best to manage our situation. We know that when we look at neighbouring provinces of BC and Saskatchewan, which at the moment have roughly similar per capita rates to us, they have been operating for quite some time with very similar frameworks in having limited fitness activities and limited indoor dining. And so I think when we look at our own situation, we need to make sure that we're looking at the evidence that we have. We're looking at the real-world evidence of comparator provinces. And we are remembering that just because we are taking this small step forward on Monday does not mean that we are fully opening those sectors, and that each small step does need to be evaluated over a 3-week period to determine whether or not those openings have caused any additional spread. And if yes, then unfortunately we may need to pause or take a step backward. And so that is what we've always said with respect to this framework, is that it's constantly being evaluated, and that our best ability to increase slowly the number of activities that we can participate in is to make sure that all of those public health guidelines are followed in every setting, every day, by all of us.